So what we found is that both the Pfizer and the Moderna trials are both showing a clear signal of increased risk of serious adverse events among the vaccinated. Now, serious adverse events are events that the companies themselves have classified as being of the most concerning quality. Namely, it's usually something that lands you in the hospital, and that's why it's classified as a serious adverse event. And the trial data are indicating that we're seeing about an elevated risk of these serious adverse events of around 1 in 800 people vaccinated. So one additional serious adverse event for every 800 people vaccinated. Now that is much, much more common than what you see for other vaccines, where the reported rates are in the range of 1 or 2 per million vaccinees. In these trials, we're seeing 1 in every 800. All right. So, and this is a rate that in past years has had vaccines taken off the market. Just to put that in some perspective, like in 1976, we had Guillain-Barré syndrome after influenza vaccines that were then, withdrawn. So, and the other thing in terms of background to understand is that we're talking about randomized trials here, right? There's a lot of studies out there, but we're talking about randomized trials, which are widely considered the highest quality evidence. And we're talking about the trials that were submitted by Pfizer and Moderna that supported the regulator's authorization. So the results are really raising concerns, particularly about the safety of the mRNA vaccines in low-risk groups. And that's why it's really important that we have an independent replication of these data using the individual participant data from the trials. When you're entrusted for protecting the public's health, and you as a regulator, you need to be in receipt of all the data. Not summaries of the data, but all the data. The most granular, detailed data should be all in your possession, and you should be going over that with as much scrutiny as you possibly can. That's a responsibility, I think, that the regulator has. As far as what we can do, we're limited. As I told you, we